Hi, I'm Karol. I'm the CEO at PA Aesthetics and Pierre Alexandre, and today I'm with Amara. Amara is our senior therapist and trainer. She works at the Birmingham clinic, and she's going to help me out today. We want to do a video for our clients with the most asked questions about laser hair removal. So everything that you should know if you're considering to have laser hair removal, or if you're already a client and you do a test patch. We'll try to answer all the questions so you feel more comfortable about coming in, really. So we've prepared some questions. Majority of them is things that you've asked over the phone or over the email, or you would ask the therapist inside of the room during the consultation. If you purchase a course of laser hair removal, usually our clients buy 6, you probably going to be asked by us to come for a test patch first, have a conversation with Amara or any other laser therapist, so we can explain you everything, how it works. So in regards to the test patch, what are the main information that the client should know before their first visit?
Okay, so when you come in for your test patch, we want you to shave 5 centimeters of the area that you're getting treated. So if it's on the face, then we ask you to shave your face, and if it's any part of the body, then we do need you to shave that area that you're getting treated on.
Okay. And after the test patch, how often does the client need to come in?
So after the test patch, we try booking you in 48 hours before for your first session. Then after that, it's 8 to 10 weeks for the face, and then for the body, it's 10 to 12 weeks.
And how many sessions do I need to have the best results?
So we say minimum of 6. Some clients do need more. And then it just depends on your hair growth. So after the 6 we do assess, and then if you need more, then we'll offer you another package.
Okay. Why do I need to shave was one of the questions.
So you need to shave because the laser needs to go into the hair follicle to destroy it. So if you're not shaving, the hair is on the surface, so the laser will just burn the hair, and we don't need that. We want to go inside the hair follicle to destroy it.
Another of the questions. Okay, so you kind of answered that you need around 6 sessions, sometimes more, but probably majority of our clients buy the 6th first because it comes as a package. How about the skin color and hair color? So
our laser machine Soprano Ice works on all skin colors. So I know in the previous technology hasn't been that good, but this technology is quite new and advanced, so it's all skin types and all skin hair. But if your hair is really light, it may not pick up. So when you come in for your test patch, we do want to assess your hair and then really.
So what's the best?
So the darker hair, it works really good. So people with white or grey hair, it might not be effective. Okay. But the darker the hair, the better.
And then, so you can have it with a dark skin and...
Yeah, all skin colours. All
cool.
skin colours.
Another question that is asked a lot, and it's really, really important, so you get the best results and you don't damage your skin really. Can I use a hair removing cream, or can I thread between sessions, or wax, for example?
Yeah, so our answer is no. So we don't ask you to do any of those things, literally just shaving. The hair cream does damage your skin, so we do say just stick to shaving.
It could irritate the skin, I guess.
Yeah, irritate and damage it, yeah.
Another often asked question is, will my hair ever grow back?
So laser is permanent reduction. Some follicles may end up as reduction hair, but you will require top-ups. Normally we do say within 6 months or within a year you need maintenance and top-up sessions. And as hormones change and some people go on different medications, their hair might come back, so you do need top-up sessions to maintain it. Okay,
so once I've completed and let's say I'm happy with the results, how do you think, every year one session?
Yeah, or? So I normally say 1 every 6 months, one every 6.
Yeah, okay,
just
fair enough.
Topped up.
Yeah. Is it painful?
No, so the laser that we use is the Soprano Ice. It's one of the pain-free machines out there. It has a cooling head with it, so it cools the area as well as it's lasering. So it kind of confuses your body, and that's why it's pain-free.
Okay, great. So what's the sensation?
Yeah, so there is sensation. So you do feel some heat and you do feel some pinpricks, but other than that, you don't feel.
Yeah, I found it quite pleasant actually. It's not painful.
Yeah, it's nothing like waxing.
You just feel that it's doing something.
Yeah.
Do we cater for male clients?
Yeah, so we cater for males and females.
Cool. And why do I need to use SPF after the laser?
So normally we recommend clients to use SPF, like especially if they're getting laser on their face, because the skin's going to be really sensitive. And if they don't use it, it can cause marks, hyperpigmentation, scarring. So we do need you to use it because the skin's going to be quite sensitive.
Yeah.
And normally we say between 30 to 50.
Okay. How long does the laser hair removal session take, for just to give clients like an idea?
Yeah, so it just depends on the areas that you're getting done. So for the face, we normally say 15 minutes, underarms is 15 minutes. For legs, between 30 to 40 minutes, it depends which therapist is doing it.
Yeah. And
then normally for full body, we leave an hour and a half.
Yeah, so it gives you a rough idea how long you're going to be having the treatment. Is there anything beside of shaving that we need to prepare before having laser?
Yeah, so we ask you not to use like sunbeds at least like 2 weeks. If you're going to go on holiday, wait until 2 weeks and then have your test patch. And anything, if you're getting laser done on your face, then like microdermabrasion, skin peels, like 2 weeks before your test patch.
Okay.
And then no products with glycolic in it, especially if you're getting your face done.
Okay. Is there a downtime to a treatment?
No, so there's no downtime. People come in lunchtime, get their face done, and then go back to work. So there's no downtime.
Right. So another thing, if the clients were previously waxing between sessions, and the biggest concern, now they need to start shaving.
Yeah.
So then they would ask, so does it mean that between the sessions my hair will be like brittle and harsh?
No, so in between sessions, like each time you come in, the laser targets 10 to 15% of hair. So each time you come in, your hair follicles are down, so it won't come stubbly, it won't come thick, or it won't like irritate you like shaving does.
Okay. That's a good question. Does the laser machine get cleaned between?
Yeah, so between every single client, our head is cleaned. We have those alcohol wipes and we clean all the laser machine.
Yeah, so basically everything is sterilized.
The new gel, a new spatula, everything is clean.
Next question is the cancellation policy. What it is?
So less than 48 hours is a £20 charge, and if we just don't show up, it is a £40 charge, and then we book you in unless we get payment.
Yeah, exactly. So we kind of ask you that you give us that 48 hours to be able to allocate that slot to another client, and yeah, so we are able to make sure that our therapists are busy, and we are able to get all the clients in that waiting maybe for an appointment. Am I able to swap my areas?
No, so we're quite strict on that. If you're buying a certain area, we need you to finish the course of 6 to have an 80% reduction. So there's no point having 3 on one and 3 on the other, because it won't work.
One of quite popular question is if I can have laser hair removal done if I have hormonal problems or condition.
So we have loads of clients that suffer from PCOS, and you can have it done. It really does help. You might not have the full 80% reduction, but you'll have a 60 to 80% reduction, and you will notice your hair is finer, it's lighter, and it's more manageable.
Okay. One of the questions is, can I have laser hair removal done while pregnant?
So we say no, we won't do it while you're pregnant at all.
Okay, and then clients would ask, can I have laser removal done while breastfeeding? So
we normally don't do it, but if you can provide us a doctor note, then we'll be more than happy to do it.
Yeah, so if your GP or doctor is happy, for us to proceed, then we feel quite safe. But not being doctors ourselves, we don't really want to make that decision for you. One of the questions, are there any skin conditions that maybe could prevent you from having laser hair removal done?
So we normally say if you've got active acne, we won't do it unless it's calmed down. And if you've got psoriasis or eczema, if it's flared up, we will avoid it, or we'll just wait until it's healed up to do it.
So you can still have it done technically?
Yes,
you can't have the open?
Yeah, we just avoid that area wherever's flared up.
What happens after the first session? So like, what should be the expectation?
Yeah, so after the first session, when you come in, like I said, every session targets 10 to 15% of hair. So once you've had your first session, wait about 7 to 10 days, 7 to 12 days, and your hair will fall out. And normally clients feel like, it's worked and the hair free, but you will notice hair coming back, and that's quite normal.
Okay. age, what's the minimum age to be able to have
So
laser
we normally
done?
say 16 with parent in the consent of the parent.
Cool. Another question is, if I have tattoo, can I have the laser hair removal done?
So we just avoid the tattoo, so we normally just cover it with a plaster and we just work around it.
Okay.
Yeah. So we can...
Oh, another, that's a very good question. Clients that are interested in the full body, which, you know, have all the areas done. Between different companies, there are different policies. So does our full body include face?
Yeah, it's everything forehead all the way down to your toes, so it's literally full body.
Yeah,
Everything.
so there is no excluded
Yeah.
areas. And are there any areas on the body that I cannot have lasered?
Probably nostrils. We don't usually tend to do nostrils. We can do the earlobes inside, like here, but we don't do nostrils.
Okay, and that's the majority of the questions that were already answered. So I really hope that you find this useful, and we're looking forward to see you on the test batch.
Goodbye.
Bye.